Hi everybody. We're going to take a look at lumbar rotations and sideline today. We have Steve here being a good patient for us. I hope you can hear us. We're trying to practice, using our mask in these times here, but let's go over this, okay? So this is going to be the technique that's the non-localized one. That's another technique we'll show you, okay? I'm going to set the patient up. I want you to do it like this every time, okay? So we got him in sideline. The first thing I want you to do is imagine an imaginary line down the middle of the table, okay? I want his hips on the other half of that table, so we're gonna slide over a little bit. Then we're gonna bring his shoulders back. So see how he's diagonal on the table? This is gonna help a few things for us. Now we're gonna take his bottom leg, straighten it out, top leg bend it up, let the foot rest in the back of the popliteal space here. Then we're gonna take this arm and just put it on his lateral rib cage here, like that. Then I'm gonna come over, you're gonna watch me come over here. So one time I will kind of come in front. We're going to try to get this shoulder out of the way. Just pull that scapula out, rest it there. If we want to, we could pull a little bit more and get a little more rotation into the spine there, but that should do. So the key part here, knee is free of the table, he's balanced, see? He's not falling forward, he's not falling back. I push him, he comes back, okay? And part of it is he's not too close to the edge of the table so it doesn't feel like he's going to fall off. So let's take a look at the examination format. Examination format is the same, okay? We're gonna look for resistance and behavior resistance, and we're gonna look at pain and the limit, okay? We're gonna stand, stride standing, hand on the posterior lateral ilium here, fingers gently towards the knee to start with, but that's all stuff we can change after, hand on the shoulder. The other rule we have is a 3-to-1 tandem movement, means this moves more than that forward. So we don't pull back on the shoulder. So we're gonna, I'll show you, this is 1-to-1. They're both moving the same, right? So to get 3-to-1, we have to just intend our movement to be more on this hand. So that's why I'm in stride standing. I'll have you come over with the camera and look at me in that position. And so my left foot's forward, directing my left hand on his ilium. And then we're just gonna lean into it just like that. And I'll just kind of go through the motions a little bit here. So now we get more movement here than we have here, okay? All right, lunging sort of movement. All right, so let's go through it. There's resistance, all right, there's R1, there's R1. Then we're gonna sample the movement through resistance. Then let's say P came on, pain, P1. Then we wanna assess the behavior of pain, if appropriate. Then we're gonna find out where the limit is, right? Remember, two-part question, limit, where is it? Where is it in the range and why is it there? Is it there generally because of stiffness, R2, or is it P2 or intolerable pain? So that's the whole setup there, just like that. That's lumbar rotations and sideline. Do it just like this every single time so you collect consistent data within patients and amongst your patients, and this way you develop those clinical patterns we talk about. Okay, have a good day.